essential blepharospasm as well as hemifacial spasm patients. But my mentor, he used to do orbiculectomy, partial orbiculectomy, and I also do it, and with a very good results. So today we would like to talk about it. So we all know what is blepharospasm. We see people, especially in the young adults and elderly patients, they are in a very miserable position. They are forcefully contracting their eyes, and they are unable to open fully their eyes, and they have got social phobias, and they are in a lot of misery. So that's the definition that what is blepharospasm. It's an involuntary spasm of both eyelids resulting in forceful eyelid closure, mainly due to orbicularis contractions. Now causes, the actual cause is still unknown, but the name indicates essential blepharospasm, so it is idiopathic. Some says that it is due to basal ganglia dysfunction. And pathophysiology is also not very well known. As I have said, that some says that it's due to basal ganglia dysfunction or overactivity of facial nerve or forceful contraction of orbicularis. So we have got medical treatments as well as surgical treatments. Most of our colleagues, they go towards the medical treatment options. So the best known and the most commonly performed procedure is botulinum toxin A injections. Sir Moeen also used to do it a lot, and a lot of our other senior colleagues, they do it with a great success. But they have got their own disadvantages, like the effect is temporary. First injection can have a 6-month effect, then due to tachyphylaxis it becomes 5 months, 4 months, and I have seen patients who have got just 1 month effect after 5 to 6 injections. Another drawback is that it's a costly injection. Nowadays I think it costs 100 units about 25,000, and most of the patients, they are poor who have got this orbicularis blepharospasm. So I have done a short series of 5 patients, all with benign essential blepharospasm, and 2 of them had 6 Botox injections, and now they were resistant to it, and 3 were having no injections. So they presented to me. All were in a miserable condition. They were unable to open the eyes fully. They were forcefully squeezing the eyelids. They have social problems. They were not able to attend functions, weddings, social gatherings, because as the common people, they don't understand the disease. They would laugh, they would taunt them. So they were totally isolated from the society. So as I am a trainee of cases were just 5, but all of the patients, they improved a lot. And I told them, I counsel all the patients that the surgery which I am performing, it is not a curative, but it will just improve your symptoms. You will be able to open the eye clearly more, and the blepharospasm definitely, as it is due to more powerful contractile orbicularis. So when we weaken the orbicularis, so it will also decrease in frequency. So they were able to open the eyes fully, and they were extremely happy. That's the C-shaped, in which we don't remove anything from the medial canthal area, because we know that important structures are there and we can't damage them. Sir, just last slide. So these are the patients, these are the 2 videos. प्ले करो वीडियो प्ले करो pre and post of video C-shaped manner. So I don't do extensive one, and because if you do extensive one you can have ectropion, lack of thalamus and all these things, dry eyes. So open one, ये वाली कर लो, दूसरी वाली. And this was a very peculiar patient which I would like to discuss, that he had a bilateral disease, and he said that as this is a very rare procedure, so he was very apprehensive. He said, just do it on one eye. I will see the result of one eye, and when I did on the right eye, his other eye blepharospasm also improved. So I am thinking that I can also do it in a single eye, and we'll see whether in other patients it improves a lot as well or not. So just 1 minute video. That's the just immediate post-op, and I have also shown after a few weeks. The eye is also closing, so not a lack of thalamus. Now that's after 2-3 weeks. Sir, the first patient which I did 1 year ago, no recurrence. Yes, sir. There's another one in which I have done little bit extensive, and she came after 6 months. There is little bit ectropion as well, but they are extremely happy, and main thing is patient satisfaction. And it's a cheap, once you can do it, you can redo it, if because I remove a small strip if there is. Sir, I'm collecting the data, and I will thank you. Yesterday.